I'd like to tell you a little bit about the special features of the Gimme lift. The backbone of the lift is the long shaft, which is reinforced on the inside. We do have the palm grip, which is at the top of the Gimme lift. It is extra wide that your fingers can fit around, and also your thumb for extra support. We have the circle on the inside here, which is used for a strap. And this strap is to help pull patients up that are unable to use their arms. We also have grips A, B, and C. These grips are soft for the patients that their hands can fit right around, nice and snug and tight. We also have the anchor pad. The anchor pad has 5 circles on the bottom of it for maximum grip. I'm going to go ahead and get you up to the side of the bed. What I'm going to do is we're going to use this Gimme lift to help assist you up. What we do is we put it perpendicular to the floor. I'm going to put my foot here as an anchor. I'd like you to put your hand on level C and D, or B and C. Okay, then what I'm going to do is on the count of 3, I'm going to pull you up, and you're just going to sit up sideways with your legs on the floor, okay? Count of 3. 1, 2, 3. Very good. We're going to go ahead and get you up now, so I want you to scooch you to the edge of the bed, please. I'm going to have you put your feet shoulder width apart with 1 foot on the lift here. Very good. I'm going to have you hold the lift here on the A and B position. Keep your arms bent into, okay? Keep them bent at all times. When I lift you up, you're going to help assist me by using your legs, okay? This will take all the pain off your incision site, okay? On the count of 3, we'll move up, okay? 1, 2, 3. We're going to transfer you up to the walker using the same techniques as we did before with the Gimme lift. Have your feet shoulder width apart, 1 foot on the lift. Hands in A and B position. Good. Keep your arms bent and use your knees. On the count of 3, we'll lift up together, okay? Ready? 1, 2, 3. Very good. Place your hands on the walker. And slide this out. Very good. Definitely, I'm going to have you use the lift for some frontal support to walk to the bathroom when we're finished, okay? So I'm going to have you scoot to the edge of the bed. Your feet shoulder width apart. Place 1 foot on the lift there. Very good. Hands in A and B position. Keep your elbows in and your knees. Use your knees, okay? On the count of 3. 1, 2, 3. Very good. You take this off from your foot here. You're going to turn it sideways. Okay, you can use it as frontal support to walk to the restroom. There you go. Do it slow. In the hospital that I work at on the surgical floor, we like to use the Gimme lift as a progressive tool. We initially use the lift in the assisted mode to help patients up and out of bed. Of course, the goal is patient safety and patient independence. The tool is then used to help patients up out of bed in the unassisted mode, to where they are able to get up and around on their own. Okay, Paul, since you've had open heart surgery and do have sternal precautions with your surgical incision here, and you have to hold a pillow and you're not allowed to use your arms, we're going to use the lift to help you get out of bed the first time by using your legs, okay? We have a strap here, which will just fit right behind you. So I'm going to have you hold the pillow. I'm going to fit this right behind you. So on this initial lift, we're just going to use the strap to loosen it up here just a little. Both hooks here. Okay. What I'm going to have you do is place your 1 foot here on the pad grip, put your other foot shoulder width apart, okay? I'm going to grip my hand here, and then on the count of 3, we're going to lift together, you using your legs so you're not putting any strain on your incision site. And I'm going to help you, okay? All right. On the count of 3, 1, 2, 3. I'm going to have you get up today unassisted with the Gimme lift up to a sitting position from the lying, okay? What we do here is we need to put the anchor pad about level with your head, okay? I want you to put hand on grip C and on the palm grip, okay? What you're going to do is you're going to push down and out and swivel your legs around to a sitting position, okay? Go ahead and try that. Very good. I'm going to put this perpendicular to you so that we can help you get to the edge of the bed to use it in the unassisted mode. Okay, just use grips A and B. Okay, to the edge. Very good. We're going to use the unassisted mode now. We're going to move the anchor pad back a little. Have you put your foot on the anchor pad. Put your hands on grips A and B. Okay, keep elbows in, knees bent. Push down, lean forward, and up. Okay, to help yourself up. I'm going to just assist you here with putting a little resistance and helping your elbow. Okay, on the count of 3, we're going to try. Okay, 1, 2, 3. Okay, Mary, I'm going to lift you up. Then we're going to transfer you to the chair, okay? Put the Gimme lift foot on the pad, feet shoulder width apart, grips on A and B. Okay, on the count of 3, I'm going to lift you up. I'm just going to have you stand, okay? 1, 2, 3. Very good. I'm just going to take the anchor pad off from your foot. Have you take a few small steps here towards the wheelchair. Very good. Now I'm going to move the anchor pad here in between your feet. I'm going to help us put one foot on the pad. Okay, I'm going to help assist you, just give you a little resistance down to the chair, okay? On the count of 3, I'm just going to have you go ahead and lower yourself, okay? 1, 2, 3. Very good. Okay, scoot to the edge of the chair. Good. One foot on the anchor pad, shoulder width apart, hands on A and B, and help lift you out of the chair, okay? Keep your shoulders in. 1, 2, 3. I have been using Gimme a lift to help assist all of our surgical patients up to the restroom, up out of bed, out of a chair. It has worked for us very well. It takes a lot of stress off of the patients with their surgical sites, off of their back and their knees, which they also usually have problems with. But it also assists the nurses. You don't need to call 2 or 3 nurses to come in and help you lift a patient. It's a lot easier for just one person to lift a patient. The patients really seem to enjoy it themselves too. They feel like they're taking part in their own recovery as well as helping the nurses out. You know, they feel like they're not such a burden to the nurses. It's really been a great deal to have this at our bedside. We have one in each room for each patient, so there's one available at all times. We also have a few at the end of the hall in case for some reason we have someone in the hallway in a chair who needs to get up. So they're always readily available. They're also available for patients who need to have one after surgery at home or in some type of rehab. They're very affordable, so it makes it very easy for a patient to get one of these Gimme a lifts, and they're wonderful. They're really great to work with. We really enjoy them. I do, as a nurse, have any problems being on my feet for 12 hours a day and doing a lot of sports when I was younger. So using this Gimme a lift has helped my knees tremendously. My legs don't hurt as bad. My back never hurts when I use it when I'm trying to pull at patients without Gimme a lift. It does put a lot of strain on your lower back, on your legs, on your arms, and there are many, many nurses who have problems with their back and their knees, and this just helps the patients and the nurses with less stress to all areas. When patients have surgery, they usually have a lot of pain after surgery. When having a lot of pain and then they have to get up out of bed because, as you all know, after surgery you have to get out of bed or else you will hurt more, that this takes a lot of pressure off their incision sites, causing them to be able to get up and move around more freely and then eventually more independently with the Gimme a lift.